want to do three things for the remaining part of our seminar this afternoon. Guess I'm supposed to talk behind the microphone. The first is to talk a little bit about some dietary philosophy relative to our church and the way we approach things. And secondly, I want to talk about the potential of what I often call nutrition evangelism. When I look at all the health programs that Seventh-day Adventist churches around the world typically do, probably the one that is done the most often is some kind of a cooking class. And it continues to be done year in and year out, every couple of years. The community continues to come. There's just a constant interest in that kind of a program. And I want to address that interest and make some suggestions and that I think can make your work more effective and can strengthen the right arm of this message when it's done in the right way. I want to begin by asking you a question. And it's a question that I was asked by somebody after a presentation one day. They came up to me and they said, "What diet should I follow so that I can live forever?" How would you answer that question? Is there such a diet? I think that the correct answer is that there is really no diet that we can eat that will help us to do that. The questioner was unmoved and then said to me, "What diet can I eat that will prevent all disease?" And I said, well, there's really no diet that can help you prevent all disease. But this illustrates a flaw in thinking that many people have. Now, I think I'm speaking to the choir, and none of you have that flaw because you're professionals in one way or another. But you all understand that life is very complex. If I were to let go of my phone here in my hand, it would not hit the ceiling, would it? It would hit the floor, and I value this thing, even though it's getting old now. I need it. And so I'm not going to let go of it. Those of you who are physicians, and all of us know, that if you take a sharp blade, call it a scalpel, and you press it with sufficient pressure on the skin, it's going to cause an incision, and that incision is going to bleed. It's a very simple conclusion to a fact. And yet, in biology, we are very, very complex people. There's always a large number of steps in the chain of events that leads to a final result. And that's the case with most diseases. Now, we all marvel at the computers that we carry around in our pockets. People say to me, well, what is these smartphones? And I often say, they're really not smart. They're dumb computers. It took a human to program them to do the things that they do. But many of you in this room, and John isn't here anymore, but he was probably the oldest in the room. He and my father were good friends, and not too long before my father passed away at 96 years old, he and I were talking one Sabbath afternoon, and he said, "You know, Fred, in your lifetime, you've seen tremendous advances in technology." And I think I had my first iPad in my lap and had been showing him a little bit about it when he made that comment. He said, "There's been a lot of advances in my lifetime," which was a lot longer than mine. The reality is that the complexity of a computer, of an integrated circuit, is really rather simple compared to that of the human body. Would you agree with that? The human body is far more complex. And we need to be careful that we don't use reductionist ideas to suggest to the public that we educate in regard to any health practice, and in particular diet we're talking about here, that there is absolute fact that if you eat a certain way, you will never have a disease, never get sick. I think we have to realize that we need to consider that it's a relatively small portion of people who smoke that actually get lung cancer. You all know smokers who have lived to a ripe old age and died of something else. Now, I'm not promoting cigarette smoking by saying that. Most people who smoke don't get lung cancer. Unfortunately, well, why should I say it unfortunately, but I hear that said. People who eat bad diets don't all live short lives. I'm amazed. Back on smoking, one of the things that I enjoy doing and have enjoyed for many, many years is climbing mountains. I've not had the opportunity of climbing the high mountains in Europe. Maybe someday I will. But I have climbed all the high peaks in the United States, and I've climbed in Africa and in Asia. And one of the things that has always amazed me is that at the top of these mountains that I have struggled to get to the top of, there's always somebody, seems like there's somebody there who's smoking a cigarette. And I say to myself, if I did that, I couldn't have made it. But you get the point. There are those who eat very healthy diets, who live very careful lifestyles, conscientiously, by God's grace. And they get some disease. And we've all seen them. My father was an example of that. He believed in the health message. He practiced the health message by God's grace. And when he was 64 years old, he had a coronary. The Lord spared his life. When they removed the breathing tube, took him off the respirator after surgery, I was in the room. And his first words were this: "Fred, I can't believe that this could have happened to me." Later, he began to realize, as he processed the sudden events that he had just gone through, he changed his attitude and he said, "Fred, I am thankful that the Lord has spared my life. And I am convinced that if I hadn't lived the way I lived, this might have happened many years earlier." But the Lord was good to him, and he lived till he was 96 years old. And that was just almost 3 years ago when he passed away. So even for those who do all the good things they can, sometimes they get sick. And there are those who seem to care less about the choices they make, and they seem to live for long periods of time. So what's going on? We understand today that most diseases are the result of a long series of mutations in genes that are vital in the integrity of thousands of other genes. Those of you who are in the medical profession, those of you who are in the health professions that have been in those professions for, say, 20, 30 years, will realize that the science of genetics today is informing us about so much that we didn't know about when we were in training. We had little glimpses of it. Read the literature today. You'll realize that genetics is a key part of understanding the pathogenesis of various diseases. Disease is caused by the complex interaction of our environment, diet, physical activity, even our thoughts and our attitudes influence the upregulating, the downregulating, the turning on, the turning off of various genes within cells that can result in disease. We have to look much deeper than a simple model of causation. You know, some of you may recognize this fellow. There may be an example in Europe. I couldn't find one. James Fix was famous for being a runner. He was a vegetarian. He hadn't always been a vegetarian, but he had become a vegetarian quite a few years before he passed away. He was thin, but he had been overweight in the past. He had smoked for a few years, and then he quit smoking. He never used alcohol. He had a low cholesterol. He had high HDL cholesterol. He exercised wonderfully, maybe to excess, as we might look back on it, but he died from a heart attack at 42 years old. And you recognize this fellow, Winston Churchill. He was an omnivore. He ate anything that came on his plate. He was overweight. He smoked heavily, anything he could smoke. He drank heavily. He had high cholesterol. He had low HDLs. He got very little regular exercise. And he died at 92 years old. So what's going on? Does it make a difference what I eat or how I live? And my answer this morning or this afternoon is absolutely. How many of you are acquainted with a game called dominoes? They're usually little black box with white dots on them. There are various ways of playing it. But when I was a child, I loved to line those dominoes up on the living room floor in a circle or in semicircles. I'd put a book down and I'd put a piece of wood and I'd have them go up over that. And you know, you almost get it all lined up and then your sibling comes along and knocks the first one. And then you have to start all over again. But that's part of the fun of it. Our healthy choices are really like taking little ropes or strings and tying up one of those blocks, or two of them, or three of them, in a whole chain of blocks. And then, when somebody pushes the end, a few of them fall over, and they stop falling. And that's what healthy lifestyle is all about, is reducing our risks, minimizing our risks. So why emphasize diet? I preached a sermon one day and only barely mentioned diet. It was about all aspects of health. And after that sermon, a lady came up to me as I was shaking hands at the door, and I could tell she wanted to tell me something. You know those kind. She had a message for me, and I saw it several people away. She was waiting to have her opportunity. And as I put out my hand and took hers, she looked at me with an intensity I rarely see, and she said, "Do you believe that Jesus is coming soon?" And I'm an Adventist preacher. How do you answer that? Only one way. I said, absolutely. And she said, then why are you talking about all this health stuff? She said, and before I could say anything, she said, when the Lord comes, I am going to be changed in a twinkling, and I can eat and do anything I want to do here on this earth because I'm going to have a new body in the next one. You've been wasting our time. What can you say? There was really little I could say, and yet I've thought about that for many years. Yes, we live longer. We have less disease. We feel better. We accomplish more when we're healthy. But the real reason that God calls us to manage what He has given us, whether it's be physically, mentally, or spiritually, is that we are stewards of the gifts of life that He has given us. And as stewards, we want to manage. If you were a multimillionaire and you hired somebody to take care of your assets and your funds, you would expect that they would not spend them frivolously. You would expect that they conserve and care for the things that you have worked so hard for. Is there any other reason that God expects us, as the giver of all good gifts, to manage that which God has given us to the very best we can possibly manage it? All the other reasons are dividends. There was a time when I didn't realize that. But today I recognize that the real motivation from a Christian standpoint for making healthy choices is not the dividends. It's that I can have a clear mind and that I can better discern God's will for my life and understand more His incomprehensible love. Managing best that which God has given us. I've talked without changing the slides here. And so I have this individual I started out with telling you about that asked me this question. When I told him there was no diet that would guarantee he would live forever, there was no diet that guaranteed he would not get any diseases, he came back with one more question. He said, what diet then can I eat to minimize my risk of disease and have the best quality of life possible? The answer to that is found in the compendiums of science today. The evidence is so strong that, as Dr. John Scharfenberg said, for 170 years we've had that message. And the evidence is only becoming louder and louder. I was at a meeting last year in Moscow at the World Health Organization meeting. in which they were talking about how they were going to fight the NCDs, the non-communicable diseases. A historic change in that organization, which has, from its beginning, focused on the communicable diseases, and now is turning its attention to the non-communicable diseases: heart disease, cancer, diabetes, hypertension, stroke. All of those are related, as you well know. God gave to us what we often as Adventists refer to as the original diet. We've already mentioned that today in our first session. I won't take time to spend a lot of time with it. Well, we often summarize that as a diet composed of fruit, whole grains, vegetables, nuts. It's a pretty simple diet. I travel on airplanes more than I ever dreamed I would now. I sit next to all kinds of people. When I have the privilege of ordering a vegetarian diet, it's often very interesting, the reaction of my seatmates. Sometimes they're totally nonplussed, but more often than not, they lean over and say, "Now, what kind of diet is that?" And more than I could ever imagine, people lean over and say, "Could I trade you? Yours looks better than mine." And we have some very interesting conversations. And they take many different directions. Many people have no idea what a vegetarian eats. They think maybe it's only lettuce. Other people have at least some idea. Oh, you're most kind. Thank you so very much. And it can be expressed in a very simple way. And these foods, as we well know, are best consumed as they come from nature, not refined, not pulled apart, not fractionated. They tend to be low in fat, they tend to be low in saturated fat, they tend to have no cholesterol, high in dietary fiber, low in refined sugar, contain rich sources of vitamins and minerals, and they are the only foods that are high in the protective substances that we call the phytochemicals and the antioxidants. It's really a healthful diet. And of course, we want to eat it in the right quantity at the right times, as we've heard this afternoon, and in the right way. A balanced vegetarian diet. The world organizations that make recommendations are now saying, without question, use plant foods as the foundation of your meals. Eating a variety of grains, especially whole grains, fruits, and vegetables, is the basis of healthy eating. Many of you probably realize that in the United States for the last 15 years, that is up to 2010, we had a pyramid, the food pyramid, which was designed to provide a food guide to the general population as to what is an adequate diet. And in 2010, they came out with My Plate. And it's a very simple illustration. And as a dietitian, I love it, because it's actually easier to communicate and educate with than the pyramid, which was very complex for many people. Yes, they put the sugar and fat at the top of the pyramid because that was the smallest portion. And people thought that's where they started. And you got down to the largest portion, and they thought that was the last. And it was always a struggle. And now we simply say, fill half your plate with fruits and vegetables. And then some whole grains and some protein foods. We know the advantages of a vegetarian diet. Lowers heart disease, cancer, diabetes, obesity, hypertension, dementia, osteoporosis, and provides a longer life. I mentioned to you earlier, and I told you I'd tell you a short personal story. My father went to Harvard University as a student in 1947. And he enrolled in a doctorate in nutrition. As he came to the time that he was to do his dissertation, to select his subject for research, he really felt that it should be on the adequacy of a vegetarian diet. And he did a comprehensive literature review of that time, and there was nothing in the literature. Nobody had looked from a scientific standpoint at the adequacy, dealing with the nutrients that both lacto-ovo vegetarians, total vegetarians, and the non-vegetarian, compared to the non-vegetarian. And he took that to his committee, the idea, and they looked at him and said, if you do that, you need to be kicked out of Harvard. There is absolutely no way we want you to do that research. And yet his department chairman, Dr. Fred Stair, was willing to support him, and against several powerful people on his committee, he was given permission to go ahead with that research. He completed the research. He successfully defended his dissertation, and then he published, co-authored by Dr. Frederick Stair, chairman of the Department of Nutrition at Harvard University, who was not a vegetarian, but co-authored in the American Journal of Clinical Nutrition a series of 5 articles in 1953 and 1954 on the adequacy of a vegetarian diet. It was pioneering work. Dr. Stair always said to him, why don't you write an article for the Journal of the American Dietetic Association? He said, I'll be glad to co-author it. You write it and I'll put my name on it. And so in 1957, my father really wrote a summary of his research that had already been published in the American Journal of Clinical Nutrition. And he submitted it to the American Dietetic Association Journal. He heard nothing. He heard nothing in 1958. He heard nothing in 1959. And Dr. Stair's name was on the article. In 1961, 4 years plus a little more after submitting that article, he received his cover letter from the president of the organization. He had submitted it to the editor of the journal. And he got the cover letter back with a handwritten note that said, in all capital letters, never will our journal publish an article on the vegetarian diet. That was 1961. I have a copy of that letter in my file. Actually, I have the letter now. It's a family keepsake, family treasure. And yet today, the American Dietetic Association, and by the way, it's now known as it's not the American Association, the American Dietetic Association anymore, it's the American Academy of Nutrition and Dietetics, but it's the same organization. And they now have a position paper that has been updated several times, in which they state, it is the position of the American Dietetic Association that appropriately planned vegetarian diets, including total vegetarian or vegan diets, are healthful, nutritionally adequate, and may provide health benefits in the prevention and treatment of certain diseases. Well-planned vegetarian diets are appropriate for individuals during all stages of the life cycle, including pregnancy, lactation, infancy, childhood, adolescence, and for athletes. And it goes on. Yes, we all recognize that there are some nutrients of concern, particularly for those who are total vegetarians. And those would include things such as vitamin B1, B12, Vitamin B12 is probably the one in particular because we know it's found only in animal products. And yet there are many sources that are available to total vegetarians. Those who are lacto-ovo probably get sufficient vitamin B12 in the milk and the eggs and cheeses that they eat. But for those who choose to eat no animal products, vitamin B12 needs to be considered. And we have various cases in parts of the world where individuals refuse to take any supplements and ignore the counsel of evidence and get themselves into trouble, sometimes very serious trouble. Calcium can or may or may not be a problem. Vitamin D, of course, can be synthesized in the sun, and for those of you who live anywhere from 30 degrees north of the equator to 30 degrees south of the equator, really have very little difficulty if you'll just get yourself outside in the sun. Problem is that today, with all the technology we have and our lifestyles, at least we in the parts of the world that we come from spend most of the time indoors. And we don't get enough exposure to the sun, even if we live in areas where we get enough ultraviolet exposure. Sometimes N3 fatty acids, sometimes iron, zinc, and iodine are probably those nutrients of concern. We won't spend a lot of time talking about it, but even the American Academy of Nutrition and Dietetics now provides very detailed guidelines as to how to make sure that even for those who choose to leave off all animal products, that they can eat a nutritionally adequate consumption of the important nutrients. I want to just interject for a moment. How many of you have heard of the General Conference Nutrition Council? A few of you have. I just want to tell you that it is an organization, it is a council that's made up of over 30 nutrition professionals from around the globe, and its purpose is to make recommendations on nutrition issues on a global basis, and we are here to serve you, the members of our church. I happen now to be the chairman of that committee. I have been a member of the committee for about 25 years, and we love to get questions on nutrition from around the world. And we have a group of individuals who are very dedicated and will do careful research if they don't have the answer to those questions and provide you with those answers based on the best evidence that is possible today. And so if you have questions come up in your field, in your area, you're more than welcome to write to me, and I will send them to the committee, and we will respond to those questions as quickly as possible. One of the things this committee did a few years ago was to develop a vegetarian food pyramid, and you've probably seen that. Some of you may have actually translated that into your languages. With the advent of the plate, we felt that there was a need to develop a vegetarian plate, and you have a sample of that in your packet. It was released at the International Congress on Vegetarian Nutrition in February, end of February this year, and we have given you a copy of that. Although it is copyrighted by the General Conference Nutrition Council, that is simply to protect our work, and any of you who wish to translate it into your language are more than welcome to do that. We want it to go as far and wide as possible. We make it available in English and now and shortly in Spanish at a very reasonable rate to anyone who wants it. But if you wish to translate it and print it in your part of the world, you're more than welcome to do that. You have a copy of the English one. We will provide you with the graphics. Again, we thought it would be good that since everybody else has a round plate, that we would have a rectangular plate, so that visually, when people see it, they're attracted to it. We wanted it to be attractive, and we're very pleased with how things came out. This is the front side of it. We also have the back side, which has a lot of information and guidance for people so they can make wise choices in providing adequately for their diet. Now, we've already talked earlier about the position of the Adventist Church. I'm not going to spend any additional time on that. It is not a test of fellowship to be a vegetarian in the Seventh-day Adventist Church. The church actually has a rather large or wide, broad pathway when it comes to diet. That disturbs some people. Some people would like to be a very narrow pathway, up a very steep hill. All of us are given the privilege of choosing individually where we go on that pathway. And we recognize that on every road, every path, there's always two sides. And if you get too far off, the ride gets pretty bumpy. It gets pretty difficult. But we have a relatively wide pathway, and that can vary from one part of the world to another part of the world. So what is the middle of the road? We let you decide that. Is it a total vegetarian or vegan diet? Is it lacto-ovo? Or is it an omnivorous diet? I would certainly caution away from the last. But let's not get too exercised and lose our Christian experience over what we think it should be and relative to what others might think it should be. I shared with you Isaiah 7. I think we need to, and I'm not going to say any more about it, I think we need to realize that the battle for our souls is really the battle for our minds. And unless our minds are filled with Christ, we can do all the good things for no purpose at all. Sometimes people say to me, "Oh, but you teach that you will eat your way to heaven." And I would suggest to you, there is no way that we can eat our way to heaven. Nutrition, health, is the gift of God. But we may be able to eat our way out of heaven by refusing the good gifts that God has given us. Do you have this kind of creature here in Europe? We call them porcupines. They have all kinds of big, long stickers. They're not very friendly to get next to. You know, our attitude is so important. Too many health reformers are prickly and unfriendly to those who are struggling at different points of growth. Vegetarians are critical of those who are not vegetarians. Total vegetarians look down their noses at those who are lacto-ovo vegetarians. And it goes on and on. I'll be very honest with you. I'm tired of the food wars in the church. Sometimes I call them the potluck wars. Potluck wars do more damage than we can imagine. We need to stop the nonsense that goes on. Now, maybe it doesn't go on over here, and praise the Lord if it doesn't. But I see it in so many places of the world. The issues vary sometimes from one thing to another. But I want to share with you a story that happened to me. I was a small part of it. I preached at a small church in the United States. I had preached at that church probably 5 or 6 times over a 20-year period. And I had seen that church thriving at 125 members, and I had seen that church struggling with 7 members. And usually when it was struggling, it was over dietary fights. Somebody with strong mind came into the church, began teaching, and offended members of that church because of their attitude. Very strident, very authoritarian, and drove people out of the church. The last time I preached at that church, just a few months before I was elected at General Conference session, it looked like they were doing really quite well. We had about 60 people, 65 people in attendance. Had a wonderful worship service, Sabbath school, worship service. They invited me to stay for potluck. I went downstairs to the hall where they had potluck after the service. And the kids were all lined up, waiting anxiously to get their food. And there was a lady there who was very much in charge of the potluck. You know those kinds of ladies. Our churches need those kinds of ladies. But she had a flaw in her attitude. She kept wanting me to come to the head of the line. I don't like to be the first to go through the line because everybody looks at what I choose to eat. I don't need to go in at the head of the line. The children are much more anxious to get the food. And she kept telling me to come. And finally she said to me, I need you to come to the head of the line and say the blessing. And so I went to the front thinking that I would offer the grace and then go to the back of the line. But as soon as I opened my eyes, there was a plate being held out in front of me. Some things you can't fight. And so I took the plate, and as I took the plate, in a voice that everybody in the hall could hear, and with her finger, she took and pointed at the first dish, and she said, "This dish has real cheese in it." And now everybody was looking at what I was going to take. What did I do? I thought for a moment and I said to myself, I have no idea who made this dish. And so I took one spoonful of it. Now, it's not the kind of dish that I would normally have taken. It's just not my favorite dish. And potlucks, you don't have to eat everything that's there, do you? I know some people pile their plates like they do, but you don't have to eat everything that's at potluck. And I pass up many dishes. But this time, I felt really impressed that I needed to take one spoonful. And by the way, when I took that spoonful, this lady went, "Oh!" just to ensure that everybody was watching. There were many good things to eat. I went to a table, had wonderful fellowship, and when the meal was over and everybody was leaving, I got up, took my plate to the counter, and I thanked the lady, although I wanted to say a little more. I thanked the lady for all her hard work in organizing the potluck. And I stepped out into the hallway, and as I stepped out, there was a lady across the hall, the door from the hall where we were meeting in the hallway, and she had tears running down her cheeks. There was no elder, no pastor around, and so I stepped over and I said, "Can I help you, ma'am?" And she said, "I've been waiting to talk to you, Dr. Hardinge." She said, "I'm the lady that made that dish with real cheese." And then she told me the saddest story I've heard. She said, "I was just baptized 4 weeks ago. And this is the third time that this has happened to me. And I told my husband this morning that if it happened today, I would never come back to that church. But she said, you took one spoonful. And she said, I'm coming back. I said, tell me a little more. She said, you know, this morning when I was deciding what I was going to make, she said, I decided to make this. I've never brought it to potluck before. Nobody's ever given me any instruction. I haven't had any classes in how to cook. I just know that you eat differently. But I don't know how to eat it. I enjoy the food, but I don't know how to prepare it. She said, I took the ham out of it. That's the pork. This dish was normally made with pork in it. I said, ma'am, let's go upstairs into the foyer, the entrance of the church. I'd like to talk to you for a few minutes. There's no excuse for that kind of behavior. There's no excuse for that kind of attitude. But we sat down, and I talked with her for about an hour. I said, don't become discouraged. That attitude was wrong. I explained some things to her that nobody had sat down and explained to her. I prayed with her, and I left. And on the way, I just had barely left the church in my car. And I picked up my cell phone, and I called the pastor. I said, you've got a problem. I told him what had happened. He said, oh, my wife and I will go and visit her this evening. He said, we've had some other problems related to this with that particular lady, the one who was organizing the potluck. And they went over that evening, and his wife threw her arms around that lady. She invited her to come to her home and to have some cooking lessons and some health lessons. And I called that pastor about a year ago, and I said, just give me a little update on what happened. He said, I just want you to know that she is still coming to church. And he said, just 2 months ago, I baptized her husband. And he said, she's in charge of potluck now. And I said, and what happened to the other lady? He said, we had many problems with her. And he said, I had to sit down and talk with her. And she took offense, and she left and went to another church. But he said, we have a lot more peace with her no longer there. You know, we need, as Seventh-day Adventists, to love people more than we do the health message. Would you agree with that? We need to love people more than we do health principles. Now, that doesn't mean that health principles are not important, that the choices we make are unimportant, or that we should just not care about the choices we make. But we need to recognize that we're working with people, and our attitude needs to be one of love and tenderness and mercy and understanding. Ellen White tells us that the cause of division and discord in families and in the church is separation from Christ. The closer we come to Christ, the nearer we shall be to one another. God is glorified as his people unite in harmonious action. I talk to many church administrators in the role I have now at the General Conference. And so many of them tell me, I don't want to have anything to do with health, because all it does is bring disunity and fight and discord into the churches. And we don't know how to deal with it. And our pastors don't know how to deal with it. We need to be like Joseph Bates, who was one of the first health reformers. He was a very quiet man. And when asked why he didn't use those things, he simply said, I have eaten my share of them. And he went about his business and he loved people. You know, I'm so grateful for the balancing message of the servant of the Lord. Sometimes we look at some of the things and say, they're troublesome. But just a few months ago, in my own study, I came across this and I thought, wow, what an appropriate statement. She said, we don't make the health reform an iron bedstead, cutting people off or stretching them out to fit. One person cannot be a standard for everybody. What we want is a little sprinkling of common sense. Don't be extremists. If you err, it would be better to err on the side of the people than on the side where you cannot reach them. In Counsels on Health, page 449, we read, let them find out what constitutes true health reform and teach its principles, both by precept and by a quiet, consistent example. You know, the first and foremost goal of health ministry is to lead people to Jesus as the agent of change and transformation in their lives. People are to be taught it is the power of God that provides a miraculous change in the life. It's not the diet they follow. God will empower those choices with right education. And this is just as true in the physical life as it is in the spiritual life. We need to yield our wills to God. Our will is to be yielded to Him that we may receive it again purified and refined, and so linked in sympathy with the divine that He can pour through us the tides of His love and His power. When Christ is central to my life, when I have been forgiven by Him, when I have been strengthened by Him, it fills my life with joy and gives me understanding and love for others who are walking the same pathway. He teaches me that I need to grow each day, physically and mentally and spiritually, and I can only do that through His strength. And when I have really internalized this, I cannot be critical of those who live differently than I do. But it compels me to seek to help them in a loving, patient, tender, and understanding way. You know, I need to gratefully accept the health that God has given to me. I need to focus my lifestyle choices on the healthful and the wholesome. And I need to cheerfully yield my desires and my appetites to the sovereignty of His love in my life. And then I can rejoice in the benefits that He grants me. And then I can rejoice in the benefits that He grants me as I make wholesome choices through His abundant grace. So whether ye eat or drink or whatever you do, do it all to the glory of God. That's my burden and my prayer for each of us as we seek to teach good, balanced, healthful nutrition to the world around us. I'm always surprised at the attitudes that are expressed. My father was 96 years old. He was still writing a book at the time he had a stroke. It was a major stroke. And he died 8 days later. I was sitting 2 days before he passed away at his side in the hospital. He was in a coma. We knew the inevitable. My sister was with me. And the telephone rang. my cell phone, and I answered it, and it was an old family friend. One who, by many standards, would be considered to be an extremist, but my father had always been gracious to him. He'd been very direct with him, but he'd always been kind. He called to tell me he was sorry that he had heard what had taken place, and he wanted an update, and I did that, and he had some very nice things to say. And then he said to me, "How old was he? Is he?" And I said, "He's 96 years old." Oh, he said, "That's a wonderful testimony to the value of a total vegetarian diet." And I may seem really nice and calm to many of you, but I have a little bit of rebel in me. And I said to him, "I'm sorry, but you're wrong." And there was this long pause. And he said, "What do you mean I'm wrong?" And I said, "My father was not a total vegetarian. He was a lacto-ovo vegetarian. He was a very careful conservative one all of his life." And I said, "I probably know it better than you do, because I've eaten in his home all of my life." And there was a longer pause. And I waited. And he said, "Oh, that's why he had a stroke." There were a lot of things I could have said, but I chose not to. I said, "Thank you for your call. Goodbye." I'll never reveal who that was. I don't want to hurt him. But you know, that's a very unfortunate attitude. And yet it exists. And hence the time I've spent today to share with you from my heart. You know, if you choose to eat a healthy total vegetarian diet, that's wonderful. But make sure you're loving about it. That you're not domineering, dogmatic, that you're not rigid, that you're not unkind and prickly. Be kind to your friends who are lacto-ovo vegetarians, who are pesto vegetarians, or those who may still eat some flesh food. And likewise, let's love each other in spite of our differences, in spite of our different views. And let's work together through God's grace. And for those of you, and I don't know who you are, my appeal to you is if you aren't quite there, get down on your knees and say, "Lord, what is it that you would have me to do?" Because I have to do that on a daily basis. And I just want to testify that God will answer those prayers. Most of you don't know me. And what I share with you now is very personal, but it's a testimony to God's power in my life. 2 years ago, I weighed 55 pounds more than I do now. That's about 24 kilograms more than I do now. I knew all the things I needed to be doing. I just liked good food in big quantities. I ate 3 meals a day. I didn't snack. I didn't exercise as often as I should, as regularly as I should. But I just enjoyed eating good, healthy food in large quantities. My father always said that I was born with the appetite of a horse. And I use that as an excuse. But the Lord Spirit came on me and he impressed me. I haven't quite achieved my goal, but bit by bit, by God's grace, he is helping me. I knew all the right things to do. I wasn't doing them because I didn't have the power in my own life. All of us have our struggles. All of us have our goals. And only when we fall on our knees at the foot of the cross and say, Lord, this is yours. You're going to have to help me with it. I want you to help me with it. Will he give us the victory? And he will allow us to grow. And that experience can be yours. Oh yeah, I have all kinds of temptations. I'm not successful every day. But I can tell you, on those days when I spend time with the Lord in prayer over this issue, he gives me strength. And I praise him for that. It's not my knowledge. It's not my experience. It's not all the things I know. It's his strength. And as I realize that he's doing that in my life, how can I be critical of others? I can only be loving to them. And my prayer is that that would be your experience also.